Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstadt. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one on one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always like to go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of the videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a patient presents to the office today for follow up. He is excited today as he states he is working out 3 days a week and watching his intake. Labs are within normal range today, and vital signs are as follows. Blood pressure is 148 over 92, respirations are 18, the pulse is 74 beats per minute, and the temperature is 98.9 degrees. Based on these findings, how should the nurse practitioner treat? Is it A, continue to monitor the patient is healthy and no treatment is warranted? B, initiate lifestyle modifications and chlorothalidone? C, initiate lifestyle modifications and amlodipine? Or D, initiate lisinopril? Take a moment and tell me what you got in the comments, you guys. All right, you guys. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So, here the stem of the question states based on these findings, how should the nurse practitioner treat? And I tell you, if they're asking for treatment, you need to run it back and see if they provided you with the diagnosis. And if they have not, run it back a step further and look at the assessment findings so that you can determine a diagnosis. So this patient came in for follow up. He's all excited because he's been working out and eating right, and he's ready for his appointment. The labs look good, they're within normal range. Vital signs are so, but the blood pressure is abnormal, right? Blood pressure is 148 over 92, so we know we need to provide some type of treatment for this blood pressure, right? Okay, so this is a healthy patient. It's exceeding that 140 over 90 range. We want to start medications. So, I always tell y'all to think of the starting four: your thiazides, your calcium channel blockers, your ACEs, your ARBs, right? You can utilize any of those, but the thiazides are always the captain of the starting four. They're the top of the first line therapy. So, unless there's something that warrants you to not utilize those, then you go with the thiazide first, right? So the best answer here is B, initiate those lifestyle modifications and chlorothalidone. So he can continue those lifestyle modifications and start that chlorothalidone. All right, question number two, a 68-year-old female patient presents to the office for follow-up today. She denies any complaints at this time. The patient has a history of hyperlipidemia and diabetes. Vital signs are as follows on exam. The blood pressure is 136 over 92. Respirations are 20. Pulse is 80 beats per minute. And the temperature is 98.4 degrees. Based on these findings, how should the nurse practitioner treat? Is it A, initiate chlorothalidone, B, initiate lisinopril, C, initiate amlodipine, or D, no treatment is warranted at this time? Take a moment and tell me what you got, you guys. All right, so here the stem of the question states, based on these findings, how should the nurse practitioner treat? So again, let's run it back. This is a 68-year-old female. Y'all know I always tell y'all when we're looking at these assessment findings to also go through the list. Look and see if there's an age, gender, or an ethnicity included, because these can help with diagnosing and treating, right? So this is a 68-year-old female. She denies any complaints. Her past medical history is hyperlipidemia and diabetes. Vital signs are overall pretty stable, but that blood pressure, being that she has comorbidities, is exceeding the goal range. Remember our guidelines. If they have comorbidities, we do not want them to exceed that 130 over 90 range, right? So we need to initiate treatment for her. So remember the treatment option that we utilize, but also key here is this patient has a history of diabetes, right? So they do need renal protection. So we want to go with B, to initiate lisinopril, as lisinopril is an ACE inhibitor. Remember, when we're trying to provide renal protection, you want to go with either the ACEs or the ARBs on those patients, okay? Then lastly, question number 3, the nurse practitioner and NP student are discussing contraindications of ACE inhibitors. All of the following are contraindications of ACE inhibitors, except, is it A, renal artery stenosis, B, hypersensitivity, C, nausea, or D, breastfeeding? Take a moment and tell me what you got, y'all. All right, so stem of the question here states all of the following are contraindications of ACE inhibitors, except. Remember, it says except, so we're looking for what is incorrect. So with ACE inhibitors, the one that's incorrect is nausea. We have covered this, but I've added more, so I want y'all to pay attention to it so you are learning those contraindications. Renal artery stenosis, ACE inhibitors are contraindicated. Hypersensitivity to an ACE inhibitor is contraindicated. Breastfeeding. You remember yesterday when we talked about pregnancy, their ACE inhibitors are contraindicated, as well as breastfeeding. ACE inhibitors are contraindicated. Nausea is not a contraindication, so that's your best answer. But make sure as you're studying this, I always tell y'all to know when to treat and then how to treat. But also, when you are considering how to treat with these medications, you need to know when things are contraindicated as well, okay? All right, you guys, I hope you're finding this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number, or shoot us an email at thenursingstudio1@gmail.com. The things that I do offer are my review book. You can get it in a paperback or ebook option. They're both linked in the bio of this channel. If you prefer to study independently, my self-paced review for family and adult Gero is also linked in the bio of this channel. If you need to do practice question, my QBank options are listed in the bio of this channel. And if you're looking to book any one-on-one sessions, I always say reach out by giving us a call, shoot a text, or email, as I like to gauge what you truly need to show you and identify which one-on-one option will be best for you and your studying needs and requirements at this time before you book a session, okay? So as always, y'all make sure to meet me back here. Happy studying. Bye, y'all.